Today we're going to be going through my emergency kit that I have created here. So first I would like to show the outside of it. Up here it says emergency kit. It's on bright neon pink just so you'd be able to easily identify this in the office. On the sides I've decorated it with some various band-aids, and then there's a contrast of color here so that you can easily tell that this would be bright enough for everybody to see. So looking inside of here, we have some different things that are essential in an emergency kit. The first thing we're going to go over would be our Bayer aspirin. Now, aspirin is essential in things like people with heart conditions and pain management as well, but most importantly, aspirin is a blood thinner, and it's something that many people take on a daily basis. It's something that can be given if someone's having chest pain, in the event of like a person experiencing angina, or like a very the early stages of like a heart attack as well. Next we're going to go through our EpiPen. And so what this is, an EpiPen is used for instances where someone would be having an allergic reaction. Now, EpiPens are essential in preventing like an anaphylactic reaction, which is like an allergic reaction that just gets like very severe. It's very life-threatening. A lot of people, if they have a severe allergy to something like bees or other like foods like peanuts and things like that, they'll actually carry like an EpiPen on them, or like if a child has some type of allergy like that, the parent will often carry it with them. So an EpiPen is what is known as like an auto injector. So it's something that you would be able to like physically give to yourself. And then like the cap comes off easily and the person can either just give it to themselves or it can be administered easily as well. Moving along, nitroglycerin tablets. These often come in a very small bottle, and a lot of times a lot of elderly people will keep them on themselves in their pockets, and they'll be in a very small vial. They're very tiny. It's a very tiny pill, usually sublingual, which just means that it goes under your tongue, and it will dissolve on its own. These are given in the event of angina as well, and also like in the event of a heart attack too. Life-saving medication, very life-saving medication, and it's used quite often. Next would be our Ventolin albuterol solution. This would be given to someone who has asthma. A lot of times Ventolin inhalers are known as emergency inhalers, and a lot of times parents will send them to school with their children, or they will keep them on themselves at all times if the person knows that they need a rescue inhaler. It's a very common thing for people to have. Sometimes states of anxiety and things can lead people to need these more than others. So especially like in a dentist's office, if a person had asthma, then they would need to have this with them, or it would need to be on file that the person has a rescue inhaler in case they needed it, because at the dentist sometimes more states of anxiety are seen than others. And the way that you would use this is you'd put it up to your mouth and you do like 2 puffs. A lot of times the instructions will be like 2 puffs, depending on as needed. Next is Benadryl, or what's known as diphenhydramine. It's an allergy medication as well. A lot of times it's used in the event that the person has an allergy and it's not as severe as something needed where an EpiPen is needed. This can help with having like an itchy throat or like a borderline anaphylactic reaction. If someone is allergic to peanuts and they catch it in time, sometimes Benadryl will take care of it without them having to do something more serious, like give themselves a shot with an EpiPen. And then this also helps with like itchy eyes and things like that. I know my brother has used it multiple times. He's very allergic to peanuts, so Benadryl he has used multiple times, and it has helped him tremendously. And then that is just taken orally by mouth as well. Next would be Tylenol. This is a pain and fever reducer. A lot of times it's taken as a pain medication in replacement of like a higher dosage pain medication, and it can help to reduce a fever as well, and a lot of times it's given to kids or adults as a fast reliever of a fever as well. And it is acetaminophen. Next is our cake icing. This one is pink. It's Betty Crocker. This will be used in the event that you're dealing with someone who is diabetic and is going into like low sugar. They haven't eaten in a while. Their sugar's getting very low. They're getting very jittery. And a lot of times this will be on their file that, you know, that they struggle with regulating their blood sugar on their own. So it's always important to ask them, you know, when the last time they ate was. You know, and if you notice them getting very dizzy, getting very disoriented, then you would know that you need to ask them, you know, hey, do you need to get something to eat? Can I bring you something to drink? A lot of times cake icing is something, you know, that can easily be eaten, but also other things like orange juice or like a Coca-Cola can also be given that will help get their sugar levels back up relatively fast. Lastly, what we have here are ammonia inhalants. They come in little packages like this that are plastic, and what you would do is you crack them open and you hold them in front of the person's nose, and often if they are experiencing syncope or fainting or they've passed out, if you will do this, a lot of times it will wake them up due to the strong odor that the ammonia inhalant gives off. So these are good to have for fainting. And just a quick review, all of these items that are in this emergency kit are things that would be essential in a dental office, but really just in any situation. Other than that as well, it's something that you could keep in your home. It's something that you could keep at school, in a daycare, a school setting, any setting really where you're just going to be around other people and people that you don't always know their medical histories and different things like that, because these items definitely cover a range of medical issues and medical emergencies that can definitely be either helped or prevented by having these items on hand. Thank you.